Hi, I'm Dr. Stefana Pecher, the Country Doc. Welcome to our third edition of High Stakes, a series dedicated to educating the community and reaching out to help people during the middle of this terrible opiate crisis that southeastern Connecticut and southwestern Rhode Island find themselves in. In fact, this has become a nationwide problem. So today we have a very special guest with us who has a very long curriculum vitae and a lot of accomplishments during his illustrious career. This is Dr. David London. He currently works out of Waterford. He's a very well-known psychiatrist in the area. And I'd like to touch upon a couple of things during his career that I think would be interesting for you all. So he graduated with his MD from the George Washington University out of DC, and he also completed his internship here. He then went on to Yale, where he completed his psychiatry residency, and then did a research fellowship in recovery from schizophrenic psychosis. He later formed a private practice in Madison, and most recently in Waterford. And since 2002, he has been practicing integrative holistic psychiatry. Some other professional activities include working at the Waterford Country School, the residential component, where he had some exposure to children and young adults with substance abuse problems. And also, he was the medical director at the Care Clinic in New London, which was an outpatient substance abuse program for adolescents and adults as well. So he has quite a background in substance abuse. He also had a teaching appointment, which is still in place at Yale as an assistant clinical professor of psychiatry in the Department of Psychiatry. Dr. London, did I leave anything out? I know there's many other items here, but fine. Is there anything else that you think would be important to touch upon? I guess this integrative holistic medicine certification.
Oh, right. Yeah, I'm certified
in functional medicine.
I'm certified in integrative holistic psychiatry and functional medicine, as well as psychiatry.
Wonderful. Well, welcome, and thank you so much for taking the time to spend it with us and share in your knowledge and teach us a little something.
Yeah, well, it's good to be here. So there's just so much that I can say, but I wanted to organize it around the issues facing someone with a substance use disorder, and then particularly focus on opiate use, which in my experience is probably the most difficult substance use to deal with. It's certainly been the biggest challenge for me as an outpatient psychiatrist working in my private practice here in Waterford, Connecticut, trying to work with people with dealing with opiates, either pain medicines or heroin. So maybe we can kind of just set the stage, because I am trained as a conventional psychiatrist, and did that from 1978 until really 1991 is when I studied Chinese medicine and medical acupuncture, and began to try to incorporate other methods that I could bring to my work with patients, where conventional psychiatry, which is mainly psychotherapy and psychiatric medications, was just not being able to solve the problem or help people get well. So I was trying to really get past what I felt was like the mind-body split, which is the major stumbling block that we in Western civilization for the last 3 centuries have been struggling with, that there is this disconnect between the mind and the body. And I turned to acupuncture, or traditional systems. I mean, it's not just Chinese medicine, but there's also Ayurvedic medicine in the Indian tradition, Native American medicine, many different traditions, where they don't have this mind-body split. In fact, in Chinese medicine, not only is it holistic in that sense, that you're treating the whole person all at once, but also spiritually as well. There are actually acupuncture points for spiritual issues. So this really reshaped how I thought about working with people and working with problems. Even though I was classically trained as a psychiatrist, I had an emphasis on doing psychoanalytic psychotherapy because of my training. It was one of the reasons I chose to go to Yale, because they had a very strong psychoanalytic training component, because they're right next door literally to the Western New England Psychoanalytic Institute. And a lot of the professors I had and supervisors for learning psychotherapy were psychoanalysts. And it really helped me to find a more dynamic way of understanding people's problems rather than just looking at a diagnostic manual, which just is a kind of a surface description of a set of symptoms. And, you know, in the years that I trained, this was perhaps the most robust way of really seeing people, seeing their whole life story, and seeing it in a developmental context, and understanding the development of their mental functions, their coping mechanisms, and understanding the stresses in development and in the relationships that impacted their personality formation, and how their personality contributes to their clinical presentation, you know, their symptoms. So it's a much more dynamic way a functional way of understanding a person. And actually the research shows that psychotherapy really does have a beneficial effect on changing brain structure. It dampens the circuit between the frontal lobes and the deeper structure of the brain, the limbic system, which is often a place of fear and anxiety. And by working through a lot of the issues in talk therapy and psychotherapy, you can break down the intensity of that circuit as you develop a stronger memories in a different part of the brain, in the hippocampus, which is where which helps with our memory. And the thing about psychoanalytic psychotherapy, or a therapy based on developing a transference between the patient and the therapist, is that it gives a very strong emotional component to the story, the narrative that a person brings to their clinical work with a psychiatrist or psychotherapist. And when they can express these strong feelings directly to their therapist, and the therapist has the training to be able to understand it in the context of their early life relationships, and that see this as perhaps a reenactment of the way they behaved in early relationships, let's say with an authority figure or a parental figure, or with a sibling, or with an intimate partner. The insight and understanding they get from not only intellectually talking about it, but emotionally experience it is so powerful that it has a much more robust effect on creating change in the brain structures. So, but in addition to psychotherapy, I mean, obviously there are a lot of problems that psychotherapy alone cannot address. And the same thing with psychiatric medications. So I, with acupuncture, began a path of moving into holistic medicine, and did more training, and have just over the last really 25 years, it's been a journey for me, lots of different trainees in acupuncture and herbal medicine, Chinese herbal medicine, Ayurvedic medicine, essential oils, and over the last 9 years in functional medicine, which is in many ways analogous or similar to my training in psychoanalytic work, because unlike conventional medicine, which focuses on looking at diseases and treating diseases, functional medicine is really looking at what is the root cause, what's driving this. So I'd like to take you through this. Can we have the first slide, please? So I want to take you through functional medicine, which is applied systems medicine. The next slide. And this is the tree, and all the leaves on the tree are diseases. And the root is like the causes. And then in the middle, as things go downstream, we start to get all kinds of different problems, and then they manifest in the form of signs and symptoms as they branch out, and then the leaves, the tree. But what we're really trying to do in functional medicine, rather than doing downstream treatment of disease, we're trying to do upstream treatment of the root. Can I have the next slide? And this is the functional medicine matrix that we use to understand a person's story as they come to us trying to get their antecedents, their triggering events, their the mediators that keep them going. We create a timeline when you start at the very beginning, actually before conception. And then as the patient tells their story, we start to populate the clinical core imbalances in the white section in the upper right. There are 7 of them, and this is where the systems medicine comes in. We have, for example, the assimilation, which has to do with the GI tract. We know now that there's a tremendous connection between the gut and the brain, and the gut and immunity. And then over on the right, we have defense and repair, which is the immune system. Below that, we have energy, which is how the individual cells in the body take nutrition from food and water and convert it into fuel in our mitochondria, which are the batteries inside our cells that make the energy that keep us functioning. And then down below that is biotransformation and detoxification, which is so important because one of the major problems now is living in a very toxic environment, and we're exposed to all kinds of chemicals in the water, in the air, in the food, in our household, and it's up to our liver and our gallbladder and our skin to really kind of eliminate these toxins. And if there's problems there, it's going to interfere. Same thing with medications. And then at the bottom of that white box is transport, which has to do with how we move things through the body. And then we have communication next to that on the lower left, which has to do with neurotransmitters, which is important in brain function, and hormones, which is important in the way the body communicates and turns things on and off and makes things happen. And then structural integrity, which has to do with literally the different structure parts in the body, the muscles, the skeletal system, the cellular structure. And then in the center, we have mental, emotional, and spiritual, all the factors that contribute to this whole thing. And then at the bottom, we have what's called the modifiable personal lifestyle factors. And these are the kinds of things that functional medicine practitioners pay a lot of attention to, because these are what we want to focus on first in helping someone move from dis-ease, that's D-I-S-ease, E-A-S-E, dis-ease, to wellness. And we're going to look at stress and sleep and relaxation, nutrition, exercise, movement, and relationships. And we're going to try to work on these first before we get to herbal supplements and medications. So it's sort of flipping the way that the traditional conventional medical approach is. Maybe we can just focus back on us for a second and have a, I said a lot, and it's a lot to absorb, and I'm wondering, what your
No,
take on it is.
this is, you're preaching to the choir. This is exactly what we tell our patients, what
Yeah.
we work on when we first meet them. We sort of spend the 2 hours with them talking, and oftentimes they know the root. They may not even realize that they know the root of their issue, but it always lies in something that happened to them in the past, or some experience that they've had that they haven't worked through properly, and then it manifests in physical problems. And it's time and time again.
Yeah.
So this is exactly true. And I'd love to hear your thoughts on this transgenerational trauma encoding into people's DNAs, or intergenerational trauma, if you've heard anything about that.
Sure, but we'll get to
Yeah,
that later
yeah.
when I talk about
Yeah,
trauma, because
yeah.
so let's go back to the next slide.
You want the slide that was? Yeah.
So these are the core imbalances, just for you to see again in a
Okay.
printed format. Assimilation, defense and repair, energy. The thing about energy is oxidation-reduction imbalances. We create a lot of free radicals in the body just by breathing and eating and digesting food, and it causes oxidative stress. And if we don't have a healthy diet that's full of antioxidants, which come mostly from fruits and vegetables, we're going to be out of balance, and we're going to create a situation where we're more vulnerable to inflammation.
Right.
And this is the new paradigm right now in not just in functional medicine, but a lot of other people. It's coming up in psychiatry. I mean, in terms of inflammation being a source, for schizophrenia, for depression, for Parkinson's disease.
Even for PTSD, I saw that there were special diets that were recommended for veterans with PTSD, and it was like low inflammatory diets.
Right.
Yeah.
So
Building blocks.
yeah, so these are the 7 core imbalances that we pay attention to, and the main thing is to understand that, traditionally, you go to an endocrinologist for, let's say, communication problems. You go to a gastroenterologist for, let's say, assimilation problems. You go to maybe a rheumatologist, immunologist for defense and repair. You may go to a neurologist if you have no energy and you're having problems, or your general medical doctor for, let's say, when it gets really bad, you have, let's say, fibromyalgia or chronic fatigue. You may see, again, your primary care doctor for cardiovascular issues like high cholesterol, high blood sugar, overweight, things that, or hypertension, things that really, that we know have an inflammatory component to them. And you may see like an orthopedic fellow or an endocrine person if you have, let's say, osteoporosis, or you have some sort of like knee problem that you need to look at, considering some kind of implementation for how to deal with a knee joint problem. So this is really, we have different specialists to do all these different things, but here in functional medicine, we're trying to create like systems medicine where you're paying attention to all these different things. And like a good general physician would do that, but oftentimes they don't have the skill set to really learn all the information they need, how to balance all of this out. Next slide. So one of the things we ask in functional medicine is 2 simple things. Does this person need to get rid of something, like a toxin, and something they're allergic to, and something that they have an infection with, a poor diet or stress? Or does this person need to have do they have an unmet need that requires optimal function? And maybe you could put the screen back on me for right now. So one of the ideas we have is biochemical individuality. You may remember in the 50s, Linus Pauling, got the Nobel Prize, sorry, for his work in chemistry on the covalent bond, and he was probably well known more for his megadoses of vitamin C curing the common cold, and there was some disagreement about whether or not that was really useful. But he, and then a Canadian psychiatrist and biochemist, Abram Hoffer, worked on megavitamins and, discovered that like you can really treat some schizophrenics with high dose B3 niacin and vitamin C. And then another chemist, Roger Williams, discovered this idea and that there's biochemical individuality, and that your need for B, let's say niacin or a different vitamin or mineral, may be very different than my need for it. And this is what's meant by, you may not be getting enough of what you need. So we really try to pay a lot of attention to this and this notion of biochemical individuality. And this is really crucial because, doctors order laboratory tests. And laboratory tests always come with a set of normals. And usually people interpret, if you're in the normal range, you're fine. But for so many people, they're not in the normal range. And then they're not fine, but they're in the normal range, but they're not fine. So that's this idea that, even though it looks normal, they're functionally not normal. Can we go to the next slide? So these are the things we need to get rid of. Toxins, allergens, microbes, stress, poor diet. And keep going, next slide. And this shows you the different levels in which we're working as practitioners, not just functional medicine. I mean, at the very bottom, we have the genetic network, our genes. You were referencing, Dr. Pecher, the transgenerational effect of trauma. And here you see right on top of that, the epigenetic network. And this is how, the combination of your genetics and your environment express, what's there. And then we move up to the metabolic network, which was this functional medicine matrix. That's basically, that turquoise color is basically those 7 core balances. And then we move up into the lifestyle factors, diet, and then yellow, we've got the lifestyle habits. And now we're moving into more the mental, emotional, spiritual, the belief network, and then the social networks. And these are they all have their own system, and they're at different levels. And disease manifests on all these different levels. And the same thing with health. Maybe you can turn the camera back. And the thing about having a holistic approach is you're really tuned in to all these different levels. And as you listen, as you work with someone, you're paying attention not just to what's going on a physical level, or what's going on an emotional level, or what's going on a genetic level, or what's going on a social level, but you're just moving in a very flowing way back and forth. And it took me a long time to figure out how do these levels connect with one another. And I believe it has to do with energy, different forms of energy, just like in chemistry. Remember, we have the nucleus with, the protons and the neutrons, and then, the electrons, and then the electrons can be in different shells. It's the same idea with energy as it moves through different levels. As it comes into matter, it comes in a different way. So even in a social network, what's going on at a social level has tremendous impact on what's going on in our belief system. And this is a good segue for us to begin to kind of move more into the impact of, let's say, the social, cultural system and substance use. Because substance use is becoming more and more of a problem as more and more people are, having problems with it, and the numbers are growing. I mean, traditionally, heroin abuse was confined to a very relatively small subculture, but now it's grown into such a situation that it's in all parts of society. It cuts across class, it cuts across ethnicity, it cuts across nation states, and then the other problem with let's say opiate use is it's not just, of course, heroin or street drugs, but it's also prescription drugs, pain medicine, and the number of pain medicines have increased, and more people are using pain medicines, and so it's very easy for people to get addicted to pain medicines, not on purpose, but just almost by accident. So these are the two things that have changed in the sociocultural dynamic. Actually more than half of chronic pain medicines are used by people with mental and emotional problems, about 61%. And this is really important. This is a new study that just came out in the last year. A lot of people go to pain clinics or to their doctors for pain medicine, but it would be really worthwhile to have substance use treatment services there, or good assessments, so that you can be clear about, is this person, does he have a substance use disorder as well as just a pain disorder?
Yeah, well, it's helpful that we can go on to the website, this government website, where you can actually see what prescriptions the patient got and from whom over several years back. So you can kind of see if there's a pattern, or if they're doctor shopping, hopping around. That's been a big help, actually. I don't know if you must use that too sometimes.
Sure. Yeah, and it's actually, and there's been more legislation to watch doctors' prescription styles, and sometimes doctors don't think twice. They just give a prescription for 30 days or 60 days with the refill for like a relatively minor surgery. And these sort of oversights are beginning to get people prescribing to be more careful and to not do that. There was a recent study that more than 100 people a day, children, are coming in addicted to with pain medicines, and in the emergency room. This is in the United States, 100 people a day. And another study showed that the most common source was from a relatively common surgery as a gateway to the pain medicines in adolescence. Can we go to the next slide? So here we have what causes the epigenetic effect. Remember, we have the genetics, and then we have the epigenetics, which has to do with environmental load, genetic predisposition, lifestyle habits, and dietary influence. Can we come back to me? And so lifestyle habits are really important, because substance use or misuse is essentially it's a behavior problem. And for some people they have poor control over it. So you could think of it as a impulse control problem. And the best treatment for an impulse control problem is to develop some awareness, to develop the ability to think before you act on impulse. A lot of people that get involved in heroin are often abusing other drugs, marijuana, alcohol, cocaine, and oftentimes their first experience with heroin is while they're intoxicated on their other substances or in a social environment where someone else invites them into it, and they don't have the impulse control or they don't have the awareness because they're already intoxicated to make a good decision about maybe I don't want to be doing this. And then, of course, access. I mean, if you have access to medicines, pain medicine, it's going to be easier to use them or misuse them than if you don't have access. I mean, one way is to get them from a doctor, or another way is to buy them or just take them from someone else. But if they're not around, you're not going to be able to use them. Now, the problem is that they're more available than ever before. And I think one of the major reasons we're seeing so many fatal overdoses is that the heroin is being cut or substituted with a very strong opiate, fentanyl. And a lot of that's coming to us from out of the country. And it's just law enforcement can't keep up with policing all of that, so it's we don't have the safety net that we used to have before because there's so much abundance of it, and when it's there, it's easy to go to. I think the other social cultural piece that's going on is the change in society. We've had a lot of stressful times in the last 20 years. And we're not used to, financial stresses, international stresses, impacts on the family with having both parents working, impacts on just being able to provide for your family and not having enough resources to provide a safe, nurturing environment for children and adolescents as they grow up, fewer societal resources as alternatives for home life, other places, community places where people can go. And I think all of this contributes. And I think another big change has been since 1984 with the personal computer, this shift gradually to now the internet and smartphones and everything being computer based, and more people getting consumed by the digital culture, which is taking them away from the more interpersonal way of life of communicating with others, because one of the biggest resources for having a healthy personal life and having a healthy lifestyle with healthy behaviors is having a good social support system, a good social network, family, friends, community.
Absolutely. And if I could add to that, the saying where people say it takes a village. I mean, in Europe, the social life is much more rich, and everyone is kind of interconnected. And what we saw in Prague, for example, they have trolleys like trams. And so if you saw a kid that was being naughty getting into the tram, some random granny who didn't even know the kid would tap him on the shoulder and say, "That's not how you do things," So it was really, the whole community was still very involved and in touch, and somebody was always around. Here, it's a little more isolated, and I think the kids are feeling it,
Yeah, and I think even maybe in Europe, I don't know about Czechoslovakia, but I know, in England, because I was there not too long ago, I mean, you're seeing the effects of a digital culture, the impact of people are not making eye contact on
Really?
on the bus, on the subway. Because
Glued to their iPhone.
they're in their iPhone.
Yeah.
You know.
Yeah, that's true too.
Yeah. So I mean, this all contributes. That's the point I'm trying to make. And if you start to screen out the environment and people in the environment, then you're more or less in a bubble.
Yes. Yes.
You know, a digital bubble and a personal bubble. And the problem with that is that you're more vulnerable to making bad decisions. And you're less interested in being concerned about what other people think about you or think of you, or how your actions might affect others. I mean, so when someone overdoses and dies, I mean, it affects the family, it affects the community, I mean, it affects their friends. I mean, it's devastating. And then the more it happens, the more frequent it happens, it becomes sort of a fear that people, young people, are carrying. I mean, now I'm talking about young people now that are dealing with that. We used to know, like, people in the inner city, the lower socioeconomic groups. I mean, we're living with that day in and day out, and that kind of creates a sense of not caring, a sense of hopelessness, a sense of almost numbing out. And then when that starts to happen, then you start to get bored with life. You start to not feel. You start to lose interest in things, and you become more vulnerable to, well, like, I want to have some fun, I want to do something, and then it's easy to, well, turn to some drug or alcohol as a something to make you feel good. Can we have the next slide? So these are the things that we need to get to thrive: food, vitamins, minerals, hormones, light, water, air, movement, rhythm, love, community, connection, meaning, and purpose. Okay, can we come back? So when I work with people that have addictions, I've learned through the years that to be effective, you really have to meet people where they're at. I mean, you try to understand where they're coming from, being empathic, really picking up on their nonverbal cues as well as what they're telling you and what they're not telling you. That's really important. It takes a lot of experience to know what they're not telling you in terms of how that could be relevant to what you're hearing, so that you can make a good clinical assessment. And if someone's in the middle of using heroin, it's very hard, or pain medicine, unless they're highly, highly motivated and have some good coping mechanisms and a support system. It's very hard to come off of it on their own, to just stop using it, or to withdraw slowly. So we do use medications, and there are a number of medications that help. We first started using clonidine, which is actually a blood pressure medicine, several decades ago, to really help with the withdrawal effects of opiates, and the sweating, the tremors, the stomach upset, the joint pain, the anxiety, no appetite. I mean, it really, the blood pressure issues. So we have other things. There's minor tranquilizers are really not all that helpful or appropriate. Some anticonvulsants, like Neurontin, are helpful for just the anticonvulsants sort of calm down the nervous system to kind of cut out the hyperactivity. But we've really, for many, many years, the only alternative we really had was replacing heroin with methadone. And but now we have buprenorphine, which is a partial agonist, and you can't really get high off of it. The thing about it is that you could only take so much to get comfortable, and then if you try to take a little bit more, it just doesn't really work very well. And then we've developed Suboxone, which is a mixture of naltrexone, which is an opiate blocker, and buprenorphine. And that's sort of a standard treatment really now for helping people to get off of heroin or pain medicine, or even cocaine for that matter, quickly. And it's relatively safe so long as it's managed. I mean, there's certain things you have to be careful of, and it needs to be, prescribed by a health professional. But one of the biggest issues is when people show up in the emergency room, oftentimes they're just referred out for substance abuse treatment, and between that emergency room visit and they never quite, a lot of them never quite make it to the substance abuse. So one of the recommendations is that in the emergency room you initiate treatment with one of these, like Suboxone, for example, and then help them to get into treatment. It makes a big difference in terms of capturing people who would otherwise just relapse. So that's the first stage is what we call abstinence, and then the next stage is a long process of recovery. Recovery requires a lot of support from the family and changing lifestyle, changing behavior, and trying to eat healthy. Taking vitamins. I mean, people going through the substance use, the brain needs B vitamins. They're cofactors for making our neurotransmitters, which are what's necessary for the brain to function. And the B vitamins are water soluble. So if you're eating junk food and greasy food and highly processed food, you're not going to have many B vitamins in you, and the brain gets robbed. And particularly vitamin B3, interestingly enough, but also some of the other B vitamins. And you need to be adequately hydrated. You get off the sugar. One of the things that people use a lot of sugar and that creates a lot of inflammation, and that bad diet, along with the nutritional problems and the substances themselves and the lifestyle, probably being up late, the poor sleep, not taking care of oneself, that's going to create a lot of stress. That's going to create problems with your gastrointestinal system, what we call the microbiome, which are all the bacteria and yeast that live on the surface of the lining of our gut that really produce 80% of our neurotransmitters. And if we have an unhealthy gut in that regard, we're going to be more vulnerable to depression and anxiety and autoimmune problems, thyroid problems, adrenal problems, adrenal stress, cortisol stress, and from let's say too much cortisol or low cortisol. Cortisol being the major stress hormone that's produced by the adrenal glands to help us cope. So all these things we want to address in helping someone feel better. This is the functional medicine way of working. So maybe want to comment about that?
Yeah, well, we're seeing a lot of, interestingly, even in people with a so-called healthy diet, lately, in the last year, 2 years, we're seeing a lot of profound iron deficiency, B12, B1, B2, B6, B3 deficiency, folate deficiency. It's really kind of unexplainable, actually, because they're supposedly eating fruits and vegetables and limiting sugar and carbs, things like that. So what we've done is we take them back to a diet that's non-GMO and as organic as possible, and then checking their water source to make sure that there's no issue there that they're not aware of. And when we do this for a period of about 2 months, and of course, introduce the supplementation of the missing or low level vitamins, minerals, we see a pretty huge improvement. And also when we add back in probiotics, whether they're in the form of a capsule or fermented, uh, you know, kimchi or sauerkraut or pickles or yogurt, we see a real big improvement, and the patients feel better. Mm-hmm. Their joint pains are better, their mood is better, energy, everything across the board. So there seems to be some kind of link to the food source, and it really appears that this GMO and non-organic stuff out there, it's really quite hazardous to our health from what we're seeing. So more emphasis is being put on that, at least in our practice.
That's great. Well, in my practice too. I want to focus a little bit on the different patterns that present. Because I said earlier that, like half of, more than half people using pain medicines have mental health problems. So I would assume that it's probably similar with, opiate use and with heroin use. Mm-hmm. Yeah. So what are some of the things we see? Well, from a developmental point of view, we're going to see some learning problems. Let's say the biggest one, the most common, is attention deficit disorder, attention deficit hyperactivity disorder, which is a disorder where you have difficulty sustaining focus and attention. You get distracted easily. You have trouble organizing. You have trouble planning. And if you have the ADHD type, the H being hyperactivity, you're more vulnerable to impulsivity. You're going to be more vulnerable to substance use. You're going to be more vulnerable to anxiety and depression. You're going to be more vulnerable to relationship difficulties. You're going to be more vulnerable to having problems with the law. So the ADHD subtype is more vulnerable to substance use. Another one is trauma, intergenerational trauma. Let's just take sexual abuse. I mean, childhood sexual abuse. It gets passed on from generation to generation because, you get trauma, you get abused. Some people that get sexually abused at a very early age, they have reactive responses where they actually get sexually charged by it, and they become perpetrators to their siblings or to, as they get older, to other children or to other people, so this. And then if you look into the history of, let's say, the parent that did that probably experienced that in their childhood growing up. So it's almost like a learned behavior that gets passed on. And we do know, when I did forensic psychiatry, I have some background in forensic psychiatry and training. I looked at sexual offenders, and they, in their conscience, they have, it's almost like there's an absence of awareness of certain behaviors when it comes to sexual behavior, sexual predator behavior. It's almost as if they're in another state of consciousness and they're not able to make good decisions, that they just impulsively do it and they don't have the awareness. So a lot of the treatments for, let's say, sexual offenders is really to develop cognitive behavior skills so that they can be fully present as they go through interacting, with people. Very, very difficult to treat, but nevertheless treatable. But the victims of sexual abuse, the victims of emotional abuse, the victims of physical abuse, the victims of trauma are very vulnerable because their spirit is broken oftentimes, and their coping skills have not, they've just sort of gone offline, and they remain undeveloped, so they move into adolescence and adulthood, and yet they haven't matured in terms of being able to make good choices. And so they're vulnerable to, using drugs to kind of take away the pain. We see this so much in veterans, people who've served in wars or have been witness to, atrocities and trauma and have post-traumatic stress disorder, as well as in children who have had repeated traumas through the years, what we call complex developmental trauma disorder. Very vulnerable to substance use. And the treatments for traumatic disorders, I mean, there a lot of calming techniques, and this also gets back to lifestyle in terms of, exercise and movement, yoga, meditation, and pet therapy. In Phoenix, they have a Phoenix Multisport where the people in recovery from substance use, they do sports together every day, and they go out into the community, and people that are just new to recovery, they're just into abstinence, they partner with them, and they get them out of the house, and they go for a bike ride. And these are the kinds of things that really help people to shift from the maladaptive coping mechanisms and behaviors of using or hiding it, being deceptive and living a double life, where on the one hand they're working and they're living at home or living in their marriage, on the other hand, secretly they've got a substance use problem they're not telling anyone about. But this is a way to begin to integrate your life and to begin to take some positive steps in your recovery and moving forward and having fun and not being alone, and and thinking about tomorrow, because that's so many times people are so full of shame that they just get so depressed, which is another avenue. I mean, particularly I find it more with pain medicine, people that use pain medicine. I mean, it's anxiety and depression. Oftentimes they're trying to self-medicate with that. There's so much shame around, and there are a lot of professionals that have this, that they can't allow themselves to get well. And so meditation is not just about mindfulness and about, cultivating the ability to kind of get out of yourself for a minute and just realize that your thoughts, and particularly your negative thoughts, those automatic negative thoughts that can trigger anxiety and panic or trigger a sense of hopelessness, they're a product of how we think. They're not who we are, and if you and when you kind of quiet down and use slow breathing, like 3 to 4 cycles per second, it really helps calm the nervous system down, and the thoughts quiet down, and you're able to gather yourself and center yourself, and it creates some space, some inner space, and all the racket that's going on in your mind, particularly if you're under stress and you've got all this stuff coming at you from the outside, work stress, family stress, parental stress, all these different kinds of things, health stress. Even with pain, when I'm working with people with pain, I'm not saying people that have pain management problems, but just people in pain. I work with meditation as a way to, because you need a holistic approach to pain management. It's not just about a pain medicine. You need meditation, you need physical therapy, massage, touch therapy, movement, all these things to help, music. Music is such an important thing for stimulating growth hormone and lifting the spirits and spirituality and religion. I mean, for some people, religion's great, and it really gives them a support, and it helps them to kind of get out of that bubble if it's just about me. Some people are not open to religion. They don't believe in God, or they can't open to a higher power, so it's going to be hard for them when they start to move into recovery, or they're trying to do it on their own through, let's say, a 12-step program, be it Alcoholics Anonymous or Narcotics Anonymous. And if for those of you who can't wrap your head around, belief in a higher power, there is a Buddhist 12-step program. There's one in Middletown that's really excellent, that meets on once a week. And there's lots of resources and books. And at the end here, we're going to have my website, and you can go there to my website resource page, and I prepared substance abuse and mental health that gives you a lot of resources where to get help for substance use, and also both for inpatient, outpatient, residential, for seeing people locally in the area, and also books to read in the 12-step programs.
That's very helpful. Thank you for putting that together.
Yeah. But the thing I want to say about spirituality, I mean, it's all about the moment. It's all about being here now and just being able, depression, a lot of times we're struggling with something that happened in the past that we feel guilty about or bad about or remorseful about or we can't quite get over. That's a lot about trauma too. And anxiety, oftentimes we're worried about something that's going to happen or that hasn't happened yet. Sometimes we don't even know what it is, kind of free-floating anxiety or just anxiety, fear of on the unknown. But if you, with meditation or just focusing on your breath or centered prayer or just staring at, out at the water at the horizon or looking up in the sky and just allowing nature to kind of be present, to be in the moment, I mean, hopefully it will give you the space and your healthy self, that, because people are more than their substance problem. Sometimes people, they make it hard for themselves because they think I'm nothing but, a junkie, and it's adding insult to injury. I mean, it's bad enough you've got a problem, but to kind of, or you or someone else kind of label you this just unidimensional thing is just so terrible. But, it's the idea of opening up to the possibility of self-love, of really healing, of just, it just takes one moment and just one thought to really just open your heart, because love comes from the heart, and just really find a smiley face in your heart, and take a breath, and feel love for yourself, and feel that you are loved by a much greater love. And allow that to be present in your life. We call these affirmations, so this is self-compassion. There's research behind this. It's not just soft stuff. I mean, there's hard research, there's brain research to really show that, meditation, be it mindfulness meditation or compassion-based meditation, which, it's all about, love and wisdom. There's research to show that it changes brain structure. I mean, we've got SPECT scans and brain scans to really show how these pathways really change. And that people, having self-compassion is probably one of the most powerful tools for helping people overcome depression and anxiety.
Well, thank you so much, Dr. London.
Oh, you're
really,
welcome.
and we really look forward to looking at those resources where I'm sure you've included all kinds of stuff, good stuff for us. So thank you so much for coming today. Really a pleasure.
Yeah, it's been great. And it's been great to be here with you. And I'm so happy that you're here in the community doing what you're doing because, I know a lot about you from, we have mutual patients and we cross-refer and because we have a similar philosophy and we're trying to do all that we can for people. And it's I know you're in it with your heart and soul as I am. And it's just great to have a fellow practitioner on the path.
Yeah, thank you so much. Really appreciated.
Thank you.
We look forward to seeing you at our next episode, and thanks for sharing in Dr. London's knowledge. Thank you.